Hello everyone and good morning to today's podcast. My name is Maryam and I am here with Dr. Ruth Wadman. Today we will be discussing one of the Child of the North reports based on the topic of mental health. The report brings together professionals from the Northern 8 Research Partnership, Health Equity North and the Centre for Young Lives, and was released as a series of reports advocating for improvements to the lives of children and young people. I'd like to introduce Dr. Ruth.
Thanks for having me. So I'm a research fellow at the University of York, and it's working very, very closely with the Born in Bradford Age of Wonder study. And my research focuses on improving children and young people's mental health.
Absolutely, and my name's Maryam and I'm a final year student at the University of Leeds, and I also work at Dixon's Trinity Academy in Bradford, which is a school in the heart of Bradford, and we serve a wonderful community of 11 to 16-year-olds. What is the purpose of this report?
So this report was all about improving children and young people's mental health and wellbeing with and through education settings such as schools. And really it's an urgent call to action to step up our efforts to prevent mental health difficulties in our children and young people. So it starts by giving an overview of the worsening mental health in our children and young people. And it gives also a light touch review of evidence-based approaches that could actually help children and young people, and a lot of them being school-based. Then we think of schools as anchor institutions, really, as a place where children spend quite a lot of their time, which makes them well placed to provide support for children and young people. And we talk in the report about creating healthy minds environments in those school environments. So in the report we also give evidence-based recommendations to the government, but we also highlight the long-term costs of inaction. So, it will involve a financial investment, but if we don't act now to improve children and young people's mental health, there will be costs down the line when those young people become adults, for example, earning less money.
Yes.
So really this is a call to prioritise and invest in children and young people's mental health, particularly in the north of England where, as you know, inequalities are quite stark.
Absolutely. I think more than ever before, it's so important that we invest in our young people's mental health and really make sure we are doing what we can to support them. Because like you mentioned, it won't just impact them now, but going forward, the impact will be really detrimental to their lives.
Yeah. Exactly. And most mental health conditions start in adolescence, or at least, are in place by the time you're a teenager. So, that could continue to have an impact across a person's lifetime, really.
Yeah, absolutely. It's so important that we get in early, definitely. So why is this report important for our communities?
Yeah, that's a great question. So children and young people's mental health has been steadily worsening over the last 20 years. So one study, for example, estimated that rates of anxiety and diagnosis have doubled in the last decade. So it really is, a pressing need that affects, all communities. And I think when it comes to the north, there are quite profound economic and health inequalities in the north compared to the rest of England. And we know that children who experience inequalities are 2 or 3 times more likely to go on to develop a mental health condition. So we know that places in the north, such as Bradford, these inequalities are really quite stark and do have quite a profound impact. So really this report highlights the needs of our communities, not just in Bradford and Leeds, but in the north as a whole. So I think that's why.
Of course, and I think the numbers that you shared are quite alarming, really. And coming from Bradford, the attitude to mental health sometimes is seen, especially in the culture that I come from. So South Asian cultures is often seen as a taboo subject, or families don't necessarily get the support that they need if the support was there. So it's really important that the awareness is being raised, and also to ensure that we're preventing that inequality gap between the north and south from widening, because it goes far beyond just the economic disadvantages.
Yeah, it does. And actually what was quite nice, because of the timing of this report, was we were able to share some initial findings from the Born in Bradford Age of Wonder study, which, as you know, is going to be the biggest study of adolescents in the world. And so, for example, we found that in 12 to 15-year-olds who completed the Age of Wonder survey in Bradford, 18% reported having symptoms that means they likely have an eating disorder. So that's 1 in 6 young people in Bradford.
Wow.
And what was also interesting, so you were talking about different communities and ethnicities, that was pretty much across the board with those different ethnic groups, which is really interesting. It's not been studied, for example, in South Asian groups, so really important.
Wow, that is, no, absolutely, we can't really stress just how important it is, definitely. So what are the recommendations around this topic?
Okay, so broadly we, as I said, urging the government, this current government and future governments, to prioritise young people's mental health. And we're advocating for a whole systems approach. So that's things like preventative strategies in schools that could, stop a mental health condition from forming. That's things like making sure when children are displaying symptoms of mental health conditions that they're identified early and that they are provided with support. Yeah. So at the moment, we know that child and adolescent mental health services are really struggling to cope with demand, but it's not necessarily the case that every child needs that high level support from clinical services. And one of the things that we specifically recommended was that these mental health support teams, which are currently operating, I think, in only 1/3 of schools in England, actually be rolled out to all schools in England.
I mean, we've got a mental health based counsellor in our school, kind of surrounding this work, and I really cannot kind of overstate the impact she's had on our students, and them knowing that there's someone that they can see kind of weekly that's there to support them. And also it means that staff can work a little bit better with the students in a school from our perspective, because sometimes there might be things there that we can't necessarily unpick, and having that mental health based counsellor who's kind of really knows her stuff and is brilliant at what she does has been so beneficial, not just to our students and families, but also to other staff from a school perspective as well. So it's really great to see that it'll be rolled out nationwide.
Yeah, and we also suggest that actually their role could perhaps be widened if possible within schools. So as well as working with individuals, what can be done at a group level or even a whole year group level, really. Yeah. Sort of with more of that preventative angle.
Of course.
So that was the first of our particular recommendations. The second was to create, if you like, these one-stop shops. So this would be a locally tailored online resource of NHS supports and community supports. So that would all be in one place, so that families could find out quite easily what's available to them locally, if their children is struggling. And then the third recommendation was to make the most of data to do what we're doing in Born in Bradford Age of Wonder, do wellbeing surveys of students in schools, across the country, and then that's acting as an emotional thermometer. Yes, really, taking the temperature of the school, and it can help with planning and resourcing if we know sort of that a school students are maybe particularly struggling with one issue. But it can also be quite useful, if a school implements some sort of intervention around mental health and well-being. We can use that data to evaluate if it's had an impact.
Yeah, of course, and it kind of relates back to what you were saying before about school being those anchor institutions, because we know that schools are the only place where those families and those children get seen day in, day out, 5 days a week. And being able to kind of support them through schools, where often are places where families trust and are kind of quite welcome often to the advice that schools give, would be really, really empowering. And not only that, it would kind of reduce the burden on a very, very overloaded NHS at the minute.
Exactly.
So it'd be really, really important, definitely.
Yeah, I mean, we're also keen in the report to stress that, you need to look beyond mental health in and of itself. You know, so numerous factors can contribute to developing a mental health condition. So things like poverty, having a neurodiversity, neurodevelopmental condition, loneliness,
of course,
sleep, all these things can contribute to mental health difficulties. So it's about thinking, how do we improve those aspects of children's lives as well?
Yeah, of course, because it all ultimately becomes that same web of problems. And often, like I said, those factors affect each other, whether it's inequality, whether it's loneliness, and it all ultimately impacts that child's well-being on the whole. Absolutely.
Yeah.
Thank you so much, Ruth, for sharing all of those insights. We really appreciate kind of your expertise and all of the advice you've given. I'd have a quick question, do you have what are your key takeaways from this?
Okay, so I've stressed that we want people to realise that there is a pressing need to improve the well-being and the mental health of our children, particularly our children in the north. So I'm going to say that again, which I have. So children and young people need good mental health, good well-being to help them develop and flourish. And we see schools as playing a key role in that, but that needs investment, doesn't it?
Of course.
We also need to harness the power of data and think studies like Born in Bradford, wouldn't it be great if that was being done?
Of course.
Across the country, capturing those different communities.
Yes, absolutely.
And capturing the experiences of marginalised groups that perhaps aren't included in some of those bigger studies. And I guess the main thing to take away from my perspective is we need to really listen to children and their families to find out what in their lives needs improving, and then we need to listen at how we can help them do that. How does that change happen?
Of course.
So those would be the key takeaways from me. Yeah.
I'm really kind of taken aback by your reflections, because I completely agree. I think the young people in the north of England have been neglected for far too long, and this is just another thing which is impacting their daily lives. And if we can kind of use this report to hopefully minimise a lot of the impact that it is having, because as we know from the report, from the research that's been done, if students do struggle with their mental health, it doesn't just impact them throughout school, it will likely impact them throughout the entire of their lives. So it's really important that our young people are not left behind for any longer, particularly from the north, and really need to make sure we can kind of give them all the opportunities they absolutely deserve.
Absolutely, and I think, it's, this report was written by experts from the universities of Manchester, Leeds, Liverpool, Newcastle. I'm sure I'm forgetting some, but so there really is this drive within the university community and in the research community in the north, that we are leading the charge in terms of improving mental health.
Yeah, absolutely. It is. I mean, it's great that it's happening now, but it has been a long time coming, and it's really kind of, as a young person and also as someone that works in school, it kind of fills me with a lot of hope that yes, we might not necessarily have had these things, but hopefully the children going through school now and growing up now will be able to access that support, which is so desperately needed.
Yeah, absolutely. And I was just wondering, with your experience in schools, is mental health something that young people, are talking to you, openly about?
Pretty much every single day. I'm trying to think of a day where I've been to work where I've not either had a chat with a child or a child has come and spoke to me about, they don't feel too great or they're struggling with their mental health. And you kind of see the continued impact of that. And I think, especially when I went through school, a lot of it was kind of coming out of COVID and the impact that going into lockdown had. But we still kind of see that impact of COVID now, and it's been 5 years since the first lockdown. So I think it will take many years to kind of recover from that. But it is a real problem that is affecting real people every single day. Yeah.
No, thank you.
Thank you so much, Dr. Ruth, again, for sharing all of your insights and for your reflections. And thank you so much to the viewers for watching our podcast. To read this report and to read other reports in the series, please click the link below or visit the N8 website.